Hi, everyone. Welcome back to Medical Mondays. If you're new here, hi, I'm Dr. Jenny Lay. I'm a family medicine physician and a mom of two. And today's topic, a very exciting one, we're going to talk about how to pick a specialty or even a subspecialty and all the things that you should really consider while picking something like this. A lot of my med students are really nervous because they think that this decision is for the rest of their lives. And so leave any questions that you have in the comment box and then I'll pull it up and then we can answer it as well. But basic overview, some things that medicine is, split into is more of the surgical procedural versus the medical aspect of medicine. And so if you think of it completely two different spectrums, you think of general surgery or surgery in general is more of like the carpenter where you're really hands-on, or like orthopedic surgery, you're doing things with your hands a lot and it's mainly surgery. The other aspect of it is medicine, where you're really interested in detective work, figuring things out and how things work or why things work, and finding the answer to things, constantly learning medicine and things like that. That is more the medical aspect, and you should think more of along the lines of internal medicine. And there's like a little bit in between where you have a little bit of both worlds, where you have a little bit of surgery and you have a little bit of medicine, and you have both, right? Some of it is more OR based, like say OB-GYN has more is surgical, but they also have a lot of medicine to it. On the, I would say not a full scope of medicine, but it still has like the reproductive organ medicine aspect of it. And then more procedural side, as in where you do stuff in the clinic, like dermatology, or say ER, where you do a lot of intubation and central lines and ultrasounds, but it's not in the OR sense. And so I think the first part is understanding what you enjoy as a medical student or someone in medicine. Do you enjoy working with your hands? Do you need to be in the OR all the time? Because if you do, then surgery is the right path. But if you don't feel like a calling to the OR, then I would say that that life is probably not for you. Like the surgeons I talk to, like they live for being in the OR. As for me, like when I did my surgical rotation, like I liked it, I enjoyed it, but never stepping in the OR again it seems fine to me. I still love working with my hands. I love, like, my favorite aspect of surgery itself is suturing at the very end. Like I love closing skin. I love making it look pretty. I love subcuticular sutures. And so for me, like doing that in the ER or urgent care or even in the outpatient clinic fulfilled my need of like hands-on medicine than like cutting someone open to do a total knee, or looking inside their intestines and all those things. And so figuring out what you actually love, like do you love surgery because love working with your hands, or do you love surgery and the other little aspects of it? A lot of people ask me about work-life balance as well, like which subspecialty has the best work-life balance. And you also have to think about, money. A lot of people go into specific subspecialties because they pay a lot of money. Like you can Google all these things, but orthopedic surgery probably pays the most money. The lifestyle is also pretty great. But if you don't love orthopedic surgery, if you're not about that life, then going to work every day is going to be a drag, and it's going to feel longer, and your days are going to feel more drawn out. As I love family medicine. Like I enjoy going to work every day. I get excited to see my patients. And so even though I am working constantly the whole day for 10 to 12 hours, it doesn't seem like work. I'm very happy and very excited. I get to do procedures. And so at the end of the day, you have to see like the career that you ultimately enjoy. So the main I think a lot of people consider like surgery versus name some of the common subspecialties and we can talk about it. Emergency medicine has great work-life balance because it's a lot of shift work. So when you're at work, and when you're at home, you're not on call. You don't have like extra work or paperwork that you have to do. Everything stays at the hospital. It's very fast paced. And so someone could come in and they could be crashing, like as in they need intubation, they need pressors, or another person comes in and you have to do a stroke workup, which is very time sensitive. And you can do like laceration repairs, intubations, aspirations, lots of procedures within the ER. Some things that you also have to consider is that that is where it ends. So you don't see patients long term. Sometimes you don't know where they end up. And if you need that more, I would say, patient connection, long term connection, seeing families and things like that, then the emergency medicine aspect of it is going to leave a hole and leave like there's something missing. Um, but for scheduling, it's great. A lot of people who like medicine and also want to do procedures, like bigger procedures like intubations, paracentesis, or thoracentesis, will end up doing internal medicine, because in internal medicine you have also can have great work-life balance. You work in the hospital, you can work 1 week on and then one whole week off. Yes, you heard me right. 1 week on and 1 week off. And when you're off, you're off. All the stuff that happens within the hospital, like stays within the hospital. The only thing is that if you're on call 24/7, then you have to come back to the hospital setting and see your patients. Everything is also very quick paced. You order a lab, it comes back later that day. Um, you get imaging studies, it comes back later that day. So the flow of your work is very quick paced. You're also working with a lot of other subspecialties within the hospital, and it feels like a community. And that's what I feel like I miss the most about inpatient medicine, like just being around my colleagues, vibing off them and talking to them and bouncing ideas off each other. On the outpatient setting, you're more, I would say, I don't want to say alone because you're still with your clinic providers, but they're all on their own schedule. They're all seeing their own patients. And so it's hard to find that time just to like stop and then discuss your thought process. With people in internal medicine, they subspecialize further. Usually, the majority of people who go into internal medicine know that they want to subspecialize, like say in cardiology, rheumatology, um, gastroenterology, and things like that. And that's where you get more procedures, right? So you'll get the colonoscopies, you can do interventional cardiology and all that stuff. And so I would say if you want to do inpatient medicine, go more towards internal medicine. If you want to see everyone in the family, kids, adults, everyone in between, then go family medicine. Uh, so I this is like all over the place because there's so many things that you need to consider. Specifically, um, another thing is patient population. So you have to think about the patient population that you intend on seeing for your entire career. So with family medicine, like I have so much variety. I see children all the way into geriatrics and even in death. And then with internal medicine, it's more of the complex patients. So you'll see a lot more adults with lots of comorbidity. And not say lots, but at least 3 comorbidities like hypertension, diabetes, hyperlipidemia, heart failure, and things like that. Whoa, it's windy outside. um, and so, and if you think about it, like I talked to an ophthalmologist, or yeah, ophthalmologist, and he was saying how he loved his patient population. They're always like the nicest people, and they're always so happy to come in and see them. And so you have to think of it in that aspect. What kind of patient population do you want to see? As for call schedule, I think a lot of people are worried about going into a particular subspecialty because they're worried about like the scheduling, if they'll ever have work-life balance within this particular subspecialty, right? And I want to ensure you that no matter what subspecialty you go into, you can find that for yourself. You can find that balance. You just have to sacrifice either location or pay or your like how much time you work, right? But it's all possible. You get to pick. For us, we wanted to stay in the Pacific Northwest, and I knew that I did not want to work full time. Full time as a family medicine physician is actually really hard because the full time is 40 hours seeing patients face to face. That doesn't count all the paperwork that you have to do, all the documentation that you have, and just like reviewing results and calling patients back and all that stuff. That all that stuff is extra that you have to do on the side. And so for me, I knew that I wanted to spend time with my family. I knew that my kids are still young, and so I can always work more later. And so I decided to work part-time. You can do that in dermatology. You can do that in OB-GYN. You can possibly do it in surgery as long as your practice is big enough for people to call you. There's always that option. And so I think that should not weigh as heavily on you unless you wanted to pay like school loans off like super fast. Then you would definitely have to work more, but you're sacrificing a lot of your time. So I think it's a balance. What else do I want to say about this? Okay, a lot of you guys are asking me, if I did not pick family medicine, what would I have picked and why? I think when I was when I was a third year and fourth year, I guess, well, when I was a third year, I really didn't know what I wanted. I'm the first person in my family to actually go into medicine. Everyone else was like a computer engineer or did hair and nails. And so I had no exposure to medicine besides the volunteering work that I did and shadowing the family medicine physicians that I shadowed. That being said, like I enjoyed every single uh, rotation that I went on. Like I loved orthopedic surgery, I loved psychiatry, I loved dermatology. I even loved podiatry, and I hate feet, and I love that rotation. And so I think going into it, I was considering emergency medicine, OB-GYN, or family medicine. And the reason why I didn't choose emergency medicine was for the patient relationships. Like I needed continuity of care. I wanted to take care of patients from their birth all the way until the end of life, and I love taking care of families. I love it when families come in together, understanding the family dynamic. That is where I like thrive. And then for OB-GYN, I had a really bad OB-GYN rotation. Like my preceptor was not the best. And so I was not exposed to a lot of OB. I don't know if my views on that subspecialty would have changed if I had a better OB-GYN. But as of now, like in residency, I delivered a lot of babies. I was in a lot of cesarean sections, and I realized that I didn't enjoy the surgery as much. Like I didn't enjoy cesarean sections as much. I enjoyed following my patients through their labor process. I loved counseling them and educating them on all the things that can possibly happen. I loved supporting them when the baby was born. And so I didn't feel like that encompassed everything if I were to pursue OB-GYN, if that makes sense. Like I can still do vaginal deliveries as a family medicine physician. And if I wanted to in the future, I can do a high risk OB fellowship where I can deliver my own babies via cesarean sections and do GYN surgery. But as I said, like I ended up not being interested in those things ultimately in the end. And the procedures that I enjoy doing are small office procedures like skin biopsies or knee injections, shoulder injections, trigger point injections, suturing skin together, things like that. And so the things that I felt like I enjoyed and I loved were were all encompassing in the family medicine realm. And the breadth of medicine is just like so deep for family medicine. I feel like I'm constantly learning, and that's where I thrive. Like I want to be on top of the newest data. I feel really anxious when I'm out of the loop on something. And so constantly learning and knowing all the little parts of things is where I'm like the happiest. And so that's why I chose family medicine and why I chose to be a physician over a mid-level provider, like say NP or PA. But these are all my personal choices. And then mentoring people. I need to find a better way to mentor people. Like I love being that resource for you, but sometimes like I can't do it for everybody. So I want to find a way that's fair. Maybe doing like a Facebook group or like kind of like that text thing. What's that text thing that people are all part of? I forget. But if you find a way for me to help multiple people at the same time, or we can all help each other, I think that would be a better way, because responding to individual people is really, really, really hard for me, especially with like 2 young kids and working in YouTube and all that stuff. But I would love to mentor people and help answer questions. Okay. And then did I ever consider dermatology? I like dermatology, but at the same time, I also love like psychiatry and psych, and I felt like the breadth of medicine was not big enough for me for dermatology. And so some people love to focus down on one thing and know every single thing about that one topic, but that's just not me. I love to know like a broad range of things and how they work together and how they like play in harmony. And so I feel like it just depends on your personality type and what you're looking for. So I know a lot of people are also very nervous and scared about trying and going for that subspecialty that is, what is it, hard to get into, like the roads to success, basically like radiology, um, orthopedic surgery, anesthesiology, dermatology, like all those harder residencies to get into. And my advice to you is that don't try to pick a subspecialty based on like the difficulty of how to get in, and don't try not to think about how long it's going to take to get through residency, because medicine is a journey. And so no matter how long it takes and no matter what road you take, whether it be like straightforward or like twists and turns, you are still ultimately going to get to your goal. And those years that you take to get to your goal is still going to pass no matter what, right? So, like, if I started medicine now, if I knew ultimately I wanted to be a doctor and it takes me 5-10 years, those 5 and 10 years are still going to pass and I'm still going to be X amount of age. You know, the time is going to pass. And so choose the profession that will bring you the most joy and the most happiness, because I think our worst fear is picking a profession more for the money or more for something else, status, where it doesn't bring you happiness. And so keep those things in mind. If you don't match a dermatology, there's plenty of people who don't match. They do a transitional year, do research, find a mentor specifically in dermatology who can write you a good letter of recommendation. There's lots of other things that you can do to end up matching into that subspecialty if that's the road that you really want to take. Don't settle for anything less. And I feel like if I wanted dermatology and I settled for family medicine and I only got to do derm once in a while, I guess like I wouldn't be so upset, because you can basically cultivate the type of patients you want to see. Like I see a lot of gyne patients. I do a lot of colposcopies and just women's health and psychiatry in general in my practice, because those are the patients that I like to see. And so those patients gravitate towards me. So I guess you can see a lot of derm patients, but it's not going to be the same. Like you're not going to feel fulfilled in family medicine if ultimately what you wanted was dermatology. And I've had people like switch subspecialties all the time, like people who match surgery and ended up in our FM program after a year of surgery, general surgery residency, because they realized they're like, whoa, this is not what I wanted. And vice versa, you know, they match family medicine and they're all like, oh shoot, I don't feel fulfilled, I'd rather do surgery. And so you can switch midway through, like in your second year or something like that, but it's a lot harder. And you have to find a place that is willing to switch you. So like someone having an open spot, or another resident who is willing to switch. So like a FM and a surgery resident willing to switch, if that makes sense. So ultimately, go with the thing that you love most. Don't settle for less. As for the interviewing process, a lot of people have like the backup. Like if they choose emergency medicine first, and if they can't match into emergency medicine, then their backup is family medicine. I've had multiple people on the interview trail who had that, and so they had to go on like 18 interviews or something. But the same thing, you know, like you really have to be happy with your choice. Anything that you rank, you have to be happy with that ultimately being the end. Right. I would recommend, actually, if you really want something, then just go for that thing and not have a backup, because it's better to do a transitional year. It's better to do research rather than matching into a different subspecialty and then trying to switch over to the specialty you actually wanted. Okay. Have you ever thought about getting another job position, like working at a hospital? Yes, I have thought about other job positions. Like as a family medicine physician, you can work in emergency medicine, you can work inpatient in the hospital. I actually got emails since the start of the pandemic, or just recently, that they are looking for physicians to work in the hospital because they are low staff. But it's not something that I can take on right now. As I said, like I love spending time with my kids. I love spending time here on YouTube. And so working more will not be good for my own mental health. But in the future, if the kids like go to school and I have more free time, then I really want to start doing urgent care. I honestly don't know if they're hiring family medicine physicians for urgent care anymore, because I feel like a lot of them are run by NPs and PAs. So if you guys know if that's the case or not, let me know in the comments, because every time I've been to an urgent care, they're all PAs. So I don't know, but definitely there's so many different aspects of family medicine that you can do. Like you can start your own practice, you can start a subspecialty clinic, you can do like all aesthetics. Like there's lots of things that you can do. Okay, let's see. So I see a lot of things like this. Step one, in many ways, picks subspecialties for people, which is not right, in my opinion. So step one has now become pass or fail. And so we actually don't look at that anymore, and we look at the application as a whole. I know it deters some people if you have a low step one score or a low step two score, but there's so much more to you than your your scores, your statistics, right? We look at research, we look at all the extracurriculars that you've done, like your personal statement. There's so much more to you than this statistic. And so I would urge you that even if you get a low score and you wanted to have a subspecialty, apply. Apply there and then figure it out from there. Yes, there are some people that have cutoffs, but if you are willing to go to a more remote location or a different location, then the option is still out there. I know a friend who did not pass their board scores and still matched eventually into orthopedic surgery. And so that is still possible. Harder, but still possible. Okay. Okay. I think I answered this question. How do you feel about people who apply to match for multiple subspecialties? Like, I, I mean, I honestly, it's, it's not what I would do, and I respect everybody else's decision because I feel like you need a sense of security, right? Um, Going through the match is a very like nervous and anxiety driven process. And so knowing what you're going to do, even if it's not something you want to do, is better than the unknown, right? Like, I don't know what I'm going to do next. It's easier to settle for something that you don't want, but the path is more clear. For me personally, if I didn't want family medicine or if I wanted another subspecialty, I would only rank that one. And that's my recommendation for medical students. Um, Ultimately, it's up to you, but I've had a lot of people who wanted surgery and matched IM and ended up not being as happy. And so uh, I guess like whatever floats your boat. And you can go from there. Like say you wanted to match surgery and you didn't match surgery and you matched internal medicine, then think of all the things that you want to do in internal medicine. Like if you're more procedural based, then you can go into cardiology and do interventional cardiology or do gastroenterology or do acute care or stuff like that. It's There's so many different paths to medicine. And so you ultimately have to find the one that best suits you. Just because you landed in this subspecialty doesn't mean that you won't love it or doesn't mean that there isn't other options to you. The path, as I said, might just be longer. I just think that, you know, if you are unhappy, it's okay to switch and it's okay to change your mind. Mm, Okay, let me see if I understand this question correctly. How do you make it clear to this specialty that that specialty is your first choice and not a backup? For example, I'm interested in FM. This is based on your whole application, right? So my personal statement, you have to explain why you chose family medicine. I think every subspecialty, you have to explain why you particularly chose that subspecialty. And then interviewing with the program directors and talking to the other residents, I think you can really convey that message well. Uh, like I always said that I love family medicine. I loved all the different aspects of family medicine. I love all the things I can do as a family medicine physician. And so I think that it would be very clear and very easy to do that as long as you make that you talk about it in your personal statement, and they'll ask you to. I think the worry. I don't think family medicine residents are actually worried about other you being interested in other things because family medicine is so encompassing. And as I said, we've had residents who joined family medicine after surgical residencies or other residencies. And so I feel like we as family medicine residents are very accepting and very like of other people. We're very kind people, or maybe that's just my residency, and so I have a biased view on how we treat other subspecialties. Okay. Great question. Would you ever consider working in telemedicine? We work in telemedicine right now since the start of the pandemic. So, with my job, I think all doctors now always have available slots for basically what we call video visits or telephone visits. It's where patients are unable to get in or they have upper respiratory symptoms like cough, runny nose, congestion. And we try to limit exposure as much as possible. And so we talk to them and counsel them through virtual visits. I have a friend who started her own primary care virtual visit or virtual clinic. And so she sees a handful of patients every so often and has a very thriving business on that. I don't know if that is something that I would want to do in the future. I feel like it's more concierge, but it's definitely something to consider. I love in-person interactions though. Like I do a lot of osteopathic manipulative medicine, very hands-on, treating patients, treating pain, realignment. Also, I love procedures, and the only way I'm able to do that is if they are in my clinic. And so, telemedicine is something that you can do in a lot of different subspecialties, but as like urgent care. You can do it in family medicine, internal medicine, rheumatology, lots of other different subspecialties. So, as I said, work-life balance. We can figure it out. What are some of the other things that you guys consider when picking a subspecialty? So, patient population, and then don't worry too much about work schedule because that can always be a workaround. Um, let's see, pay, and then try not to think so much about the duration of the residency training. Like I honestly sometimes really do miss residency training. Like I miss learning all the time, having so much information all the time, and feeling like I grew and constantly growing as a person, as a leader, as a team player. Like I honestly miss it. And so, you know, if residency was dragged out a little bit more, I probably wouldn't be as angry. I don't know, but Stan hated it. Like I was gone all the time. If I had the best of both worlds, residency would be like a normal job, like say in other countries, like Europe and things like that, where you work normal hours, like 40 hours a week, and you continue your training. And that lasting instead of 3 years, that lasts 6 years. Like I'd be down. I'd be down for something like that. It's just in residency, you are worked to the core. Like I had two babies. Like I had Wyatt right before starting residency, and then I was pregnant and had London second year of residency. And so it was nonstop. I didn't sleep, 80 hours a week, so much responsibility, and it just drained you mentally and physically. But if it could be like normal working hours, if we were treated like people, like I can extend that for longer periods of time and still be really happy. So yeah, I just wouldn't get paid money at all. Have a substantial amount of school loans, but still very happy. Okay. Let's see. Oh, I have this. Any advice would you give to someone in their final year of medical school who doesn't know what subspecialty they want to pursue yet? If you truly don't know, like have no inclination of what you want to do, then I would say do a transitional year, either that be a medical transitional or surgical transitional year, so that you have that time to decide. You'll still be working as like a resident in a residency, but it's like kind of like a stepping stone, right? So all people in ophthalmology have to take a transitional year anyways, and then match into ophthalmology afterwards. So it's not like you're wasting that year, you're getting more experience. And think of like why you can't decide what you want to do. Is it because you love everything or you don't love anything at all? I would say if you love everything, then truly consider family medicine. During my family medicine rotation, like I would have to admit that some of it was kind of boring. And some of the time I would look at the watch and like, has the day, like, is it over yet? Can we go home yet? But it's a lot different when the patients are yours and you have that personal connection with them. It's like talking to your friends or talking to your family members when they come in. It doesn't feel like work, and the time passes by so fast. And so it's really different. Also, like all the procedures that we get to do. Last week, I think I did a colposcopy. I did multiple knee injections, skin biopsy, and trigger point injections. And that's just like a normal 3 day or 2.5 day work week. And so if I worked full time, I would be getting a lot more procedures. But think of all the things that, why can't you pick? Like, is there, and then what is it that you want in your final specialty? Like for me, I knew that I wanted continuity was very important to me. I wanted to develop relationships with my patients. I wanted to be happy when I saw them and them to be happy when they saw me. I wanted to do procedures, specifically smaller in clinic procedures. And then what else did I want? Yeah, those were the main two. So those were my non-negotiables. So think of that. Think of the things that are non-negotiable for you. Most of the surgery people would say, I need to be in the OR. That's a non-negotiable. So if that is you, then you need to go into surgery. Okay. 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 Question. Have you noticed an increase in primary care salary with high demand for primary care providers and aging populations? I don't know. This is a really hard question because doctors are horrible at negotiating their pay. I am part of a doctor group where they compiled a salary list for geographic location, but I haven't looked through it as of yet. But it compares like all the people in your region and tells you like how much they're actually paying you. I think they are continuing to pay us less and less because medical schools don't teach us interview skills, they don't teach us negotiation skills, and it's like considered, I don't know, like we don't talk about our salary to each other when I don't know why. Like we as doctors should be very open about that to help each other because the more that we are paid, the next person is going to, you know, raising our standards, I guess I would say. As of right now, some of the doctors are getting paid like a tiny bit more than PAs and MPs. And I would say that that is very like big discrepancy, because all the training and loans that we have, it just sucks if that's the case. Yeah, but I would say as of right now, I'm getting paid as much as my internal medicine colleagues. I have videos on this in the past. I'm very transparent about how much I get paid. I'm working part-time. I'm getting paid about $120,000 a year, and that's like before tax. So a little less than that. And I have 2.5 days a week that I work. And then on the side, I do YouTube. So it comes out to be, after taxes and all that stuff, I want to say, and then paying for health insurance and all that stuff, I probably take home probably a little less than $100,000 a year for working 2.5 days a week. I haven't had to start paying back my school loans as of yet. That starts in January. And so I'll give an updated video on how that is going, if we're struggling or not. But as of right now, I think that if doctors actually talked about their wages and if doctors all stood together and if we started learning negotiation skills, we can get more for what we're being offered. That's all I'm saying. We're underpaid. Okay. Let's see, other questions. Oh, this is a good one. How do you feel about psychiatry as a specialty? I love, I love psychiatry. I feel like psychiatry in itself has helped me become a more happier and healthier person, understanding my own mental struggles and dealing with all the trauma that I've been through in childhood has helped me become not only a happy person, but a better physician and to be that, you know, that shoulder or that person, that grounding person for my patients. Uh, I don't know if I can do that all the time and every day because I still have issues with setting boundaries. If you guys follow me on Instagram, you know, I talked about this previously, but I'm an empath. And so I feel a lot of things from my patients. Like I can walk into a room and I can be like, that person's feeling this and this person's giving off that energy and this other person's feeling this thing. Like I can read a room. Like, so when I see my patients, I can step in and I can generally feel what they're feeling, like their excitement or their fear or their anxiety. And feeling all those things all the time is very, very tiring for me because I haven't found a way to be present with them, but still holding back and stepping back into my own and then feeling my own emotions after. Like at the end of the day, if I have a patient who is very sad or depressed or has gone through significant loss or trauma, like I find myself coming home and binging, like emotionally eating my feelings and trying to fill a void that is there that, you know, is caused by something else. And so I know that is happening and I just can't stop it. Like I have no motivation or I have no willpower to even stop that. And so I think that psychiatry is an amazing subspecialty. I just personally can't be doing that all the time. I love little bits of it. And that's why family medicine is so great. Okay. Um, Sorry, I'm laughing about this. Dave Ramsey scared me away from loans, man. So I want to talk about Dave Ramsey for a second. Like, I do not agree with a lot of the things that he says. So Dave Ramsey talks about like working and paying yourself through medical school. That would have worked like many, many decades ago. Like I had physician patients who were like, oh yeah, I graduated from med school and residency with $800 loan and my parents paid for blah, 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 blah. There is no way that I would be able to do that. One, because the cost of medical school has gone up substantially. Number two, I do not have rich parents. They are low income. I've been on my own since like 16. And so they don't pay for anything. So, number three, there's no way that I'm going to make $40,000 a year on top of going to school full time to be a doctor. Like, that's just not possible. I would fail my classes. I would have zero mental health. My body would go to shit just so I would have zero debt. And so, for me, if you think about it, all the rich people have debt. And I think that it's taking out school loans is an investment on myself. It has given me a career that I enjoy and has given me these talents to be able to make money in the future. So I have $350,000 in school loans. I know, I know, it's a lot. 20,000 of that is probably from undergrad at UCSD. But I don't regret it one bit whatsoever. I love my life right now. I love my career. I love seeing my patients. I love where I am. And so without that loan, I would not be able to be here where I am today. And so I don't stress about it. I have a large sum sitting in the bank that we're going to try to pay off. Well, you know, doing lump sums and then trying to pay down as quick as possible. But it's not going to kill me. Like it's not going to really severely affect my quality of life. Like I'm still going to take vacations. I'm still going to, you know, send my children to school right now. And so I don't know. I think there's always that perspective. Like you have to have that perspective on loans. Like, is it going to be debilitating or is it not going to be debilitating? So, yeah, I don't believe in what Dave Ramsey says. Like, just work your ass off to pay for school loan or to pay for medical school because it doesn't work. You can't do that. At least for the majority of people, 90% of people. Okay. Let's see. Let's see. Any other questions you have? I know this video is kind of all over the place, so let's do an overview of things to consider, right? So, yes, study hard or study smarter, I would say, get the good grades and all that stuff. But one is think of the patient population that you want to see for the rest of your life, right? And number two, what are your non-negotiables that you must have in your career? Is it um, is it the patient population? Is it the continuity? Is it the procedures? Is it the OR? What are your non-negotiables? Write that down and see if any of those things change while you're doing clinicals. What did I say already? Patient population. Okay, non-negotiables. And then think of like, where would you like to spend your time? Do you want to spend it in the hospital or do you want to spend it on the outpatient setting? And that's like internal medicine versus family medicine. And then also like, do you want to do OR based medicine or do you want to do like medical based medicine? So I don't think that's a good order to think of it in though, because all those things are kind of like you need to think of it in a line rather than like you need to think of it as in like A, B, C, D, E, like all equally instead of like 1, 2, 3, 4. So it just depends on what's important to you, right? I think I started off with what kind of patients I want to see, what are my non-negotiables, and then do I really need to be in the OR or not? And then I thought about whether I wanted to work on the inpatient or outpatient setting. And then lastly, I thought about pay, but it didn't make a big difference to me. All right. And then, okay, there's this other question. Ask me about all the different subspecialties and I can tell you. So, opinion on anesthesiology. I think anesthesiology is a great career. Like you has great work-life balance. I would say that you do cases, you're on when you're on, and then you're off when you're off. Like there's not much documentation there. There could be the same like I would say documentation as in you don't have to write much for your documentation. There is probably like a preset of things and you generally do the same things for anesthesiology unless something goes wrong and then you have to document more of all the things that went wrong and then all the things that you did to fix it, right? And then the times that I spend in anesthesia, like I help with intubation, but the rest of the time I'm like on the phone, reading articles, researching stuff. And so it's really chill. Other things that you can go into in anesthesia is like if you want to go into pain medicine, you can do radio ablation or different other procedures within anesthesiology. And so I think it just depends on the type of life you want. Like it doesn't interest me to watch people asleep. But some people really like that. Some people love like the chemical aspect of anesthesiology, like the whole process of how people are put to sleep, all the different medications. They love the procedural aspect of anesthesia. But for me, like it didn't excite me. It didn't, the rush of it, of intubating someone and that whole process of setting up the IVs and all that stuff, like that didn't excite me. But as I said, that's just my personal opinion. Okay. What are other ones that people generally like? Like what other subspecialties? I have a whole video on med school loan forgiveness, and I'll link it in the description box. But I am personally not part of public service loan forgiveness, and the reason why is because even though it's like a great program, number one, I am not part of a hospital that is continuing that. So in residency, I was part of public service loan forgiveness, but then my current job, they're not public service, they're for profit, I think, or they're private. And then thirdly, you have to work full time. And as I said, I'm unwilling to work full time. So you have to work full time for the 120 payments or whatever, it's like 10 years in totality to have your loans forgiven. And I am just not ready to do that. Okay. Radiology, also awesome. If you like to stay in a dark room and look at imaging studies, there's lots of different things that you can do in radiology, like do interventional radiology. So you get to still interact with patients occasionally, but it's mainly more of the images that you'd be doing and looking through all the imaging studies. So less patient interaction. If you would prefer that, I know some people are like, I don't want to see patients at all. And so they either went into radiology or pathology. And so those are really, really different aspects of medicine. And then interventional radiology and then interventional cardiology, also a great course. You have great work-life balance. But the training is long. So you go through 3 years of internal medicine, subspecializing in cardiology for another 3 years, and then doing a fellowship in interventional cardiology, which I believe is another 2 years. But I love it because cardiologists are so smart. Some of the cardiologists I know are the smartest people, and they understand the medicine aspect of it and how things work together. And they have a lot of counseling for preventative stuff, and at the same time they have all these procedural aspects that they can do. So it's all a lot of hands-on as well. I'm not sure like how much clinical work. I feel like you will still always have clinical work because then you have to talk to your patients about the surgery and counsel patients on what to expect and the healing process and all that stuff. So you'll still have some interaction with patients and follow-up. But I don't know how much of it you'll get. But it's a great of both worlds if you are very like medically driven, like if you want to understand everything that's wrong, if you want to know like how the pathophysiology of stuff works, specifically for the heart, and then do something about it physically, then I think interventional cardiology is a great option. Okay, hospitalists versus locums. As a hospitalist, you are like, I feel like hospitalists or locums is kind of the same. So think of it as when you're a hospitalist, you're with that hospital and your schedule is more concrete. So you can have like a week on or a week off or pick up shifts, as compared to locums where it's more like part-time, and then you can do like different hospitals in locums, and you can do like 3-4 stretches at a time. It's something where locums is something that you can definitely do like in between. Like I had a family medicine physician who did hospitalist locums like from time to time. It's just whenever they have a surge or when they need you more. I think sometimes locums gets paid more if you go to like a remote area and you have to travel. So it's harder with a family because sometimes you'll be staying further away, an hour or two away from your home, but it'll be like for a few days at most, I think 7. Maybe some crazy people will do 10, but that's just too much for me. Okay. Some fellowships that you can do as a family medicine resident, lots of them. There's sports medicine, there is high risk OB. These are some of the things I'm considering, so that's why they're first. There's palliative medicine, emergency medicine, lots of different things. You can specialize in mental health if you wanted to further subspecialize. I think that that's why a lot of people love family medicine residency so much, because there's so many different options. In the beginning, as I said, like I possibly considered high risk OB because I didn't know if I wanted to let go of my patients and had someone else do their cesarean section if they ended up becoming high risk. But as I said, I ended up not being interested in gyne surgery as much, or OB surgery as much. And so those are some of the things. But so many more. I think if we looked it up on the AAFP website, you can see like family medicine subspecialty or fellowship. List AAFP. Okay. So I'm pulling this up right now. Well, okay, here. I'll show you what I'm doing on this other screen. Okay, do you guys see this? Okay. So there's so many. If I want to say Arizona, oh, look at all the different things. Okay, so addiction medicine. There's addiction medicine, which I have already a training for. I prescribe Suboxone, all that stuff. Adolescent medicine, emergency medicine, geriatrics, hospice, hospitalist, integrative medicine, obstetrics, preventive research, role medicine, sleep medicine, sports medicine, urgent care, women's health. So those are all the things that you can subspecialize in or like fellowships for listed. I wonder if there's, yeah, we had a lot of rural medicine in my residency that we learned about, which was pretty cool. You can also do neuromuscular medicine, which is its own subspecialty, like an OMM specialty fellowship afterwards, which I was also interested in. So, all right. Let's see. I think I have two questions like this, so I'll answer it. What do you think about combined specialty residency in like med peds or psych IM? Would it be hard to specialize in both? I think if you're in that particular residency, like the residency itself should be training you in all aspects to have you be specialized, and you maybe have to take like the boards specifically for both of them, but I don't think that it would be hard to specialize in it. Like it might just be a longer residency. I had like a med student, like one of my med students in my class, she was peds EM, I think, peds in emergency medicine. But I don't think that it would be hard because your training itself, the program that you match into, is supposed to properly equip you for your real life attending job. So don't worry. If you're interested in both, then definitely go that route. I just wasn't sure if that was the route for me. And so like family medicine, blah, blah, blah was a lot easier. Psych IM is so different though. Like I feel like it, like you have time in your practice as a family medicine physician to talk to your patients about, like their own mental health and things like that. And I feel like on the outpatient basis, it's a lot easier. But on the inpatient basis, like things are so fast paced. And so it's hard to spend that time, like an hour, talking to the patients. And that's why we consult other subspecialties. Don't try to be everything for everyone, because you just can't do that. Know when you can work with your teammates. Know when other people can help you, and lean on them. All right. Yes. So the first year of psych residency is internal medicine. So the first year of every subspecialty is internal medicine. Like, you have to do internal medicine for all the things, for surgery, I would say all the things, at least a few months. And the reason why is because everything works together as a whole, and everything, you're not going to understand if you're only treating one aspect of the body, how it is going to play out and how it's going to affect the rest of the body if you haven't learned all those things. And so no matter what subspecialty you are, oh my gosh, the sun. It doesn't matter what subspecialty you are, you will have a year of internal medicine to begin with, like even dermatology. Okay. All right. I think that's all the time we have for today. I ask all your questions in the comments, okay? And I'll be sure to answer them. It's just that I haven't had lunch yet. And it's getting really sunny. It's getting hot. Okay. Thank you all for joining me today. Sorry I was all over the place, but let me know if you want me to talk more about this, any specific questions you want to talk about. I'll link my school loans video down there so you can watch all that, and then we can talk about it more. Okay, let me know what you guys want me to talk about next week, and so I could come up with more talking points. Okay, bye, peace.